Clinical Lectures on Certain Diseases of the Nervous System by Professor J. M. Charcot, Professor to the Faculty of Medicine, Paris, France, Physician to the Salpêtrière, Member of the Institute and Academy of Medicine, Honorary President of the Anatomical Society, etc. Translated by E. P. Hurd, M.D., Member of the Massachusetts Medical Society and of the Climatological Society, Newburyport, Massachusetts, 1888. George S. Davis, Detroit, Michigan. Table of Contents. Lecture 1. Spiritism and Hysteria. Summary. Influence of intellectual excitations on the development of hysteria. Belief in the supernatural, of the marvelous, practice of spiritism. Account of an epidemic of hysteria in a family of 3 children inhabiting a military penitentiary and addicted to spiritism. Antecedent nervous and rheumatic attacks. Description of the attacks. Hallucinations of fright, permanent and variable stigmata, conclusions. Lecture 2. On Isolation in the Treatment of Hysteria. Summary. Retrospective details respecting a little epidemic of hysteria. The treatment ought to comprehend 3 points. A. Psychic or moral treatment, including 1. Separation from the place where the hysteria developed. Separation from each other of the persons affected. 3. Suppression of all visits on part of parents or friends. B. Medical treatment. 1. To modify the diatheses, if any exist. Rheumatism, for instance. 2. Static electrization. 3. Methodical hydrotherapy. Preponderant influence of isolation. Example, the treatment has been adopted, not first proposed, in Germany and in England. Lecture 3. Choreiform movements and tremblings. Rhythmical chorea. Summary. The trembling of multiocular sclerosis, of paralysis agitans, senile tremor, tremor with slow oscillations, with rapid oscillations, vibratory tremblings, hysterical trembling, alcoholic mercurial tremor, the tremor of general paralysis, of Basedow's disease, chorea, characters of the involuntary movements of Sydenham's chorea, chorea and hemichorea, pre- and post-hemiplegic athetosis and hemiathetosis, rhythmical chorea, characters of the movements. They manifest themselves under the form of crises. They are cadenced, systematic, and reproduce more or less faithfully certain movements of ordinary life, chorea, saltatoria, maleatoria. The disease is generally linked to hysteria, prognosis varying according to case. Lecture 4. Muscular atrophy consequent on certain articular lesions. Summary. Articular traumatism, consecutive paralysis, and muscular atrophy. Modification of the galvanic and ferritic contractility. Contractions provoked by the electric spark. Exaggeration of the tendinous reflexes. Simple muscular atrophy. There is no necessary relation between the intensity of the joint affection and that of the paralytic and atrophic phenomena. The extensors of the joint are affected in predominant manner. The muscular lesions are under the dependence of a deuteropathic spinal affection. Lecture 5. Contractures of traumatic origin. Painless tick of the face in a hysterical patient. Summary 1. Influence of traumaticism on the localization of certain diethetic determinations. Contracture of traumatic origin in subjects who present spasmodic rigidity in the latent state. Exaggeration of the tendon reflexes in hysterics. 2. Typical tic non douloureux of the face. Contracture of the muscles of the face in a hysterical patient. Simulation. Lecture 6. Muscular atrophy consecutive to articular rheumatism. Summary. Muscular atrophy in the acute, subacute, or chronic arthropathies. Relationship between the localization of the atrophy and the seat of the arthropathy. Types of primary chronic articular rheumatism. 1. Primary generalized or progressive chronic rheumatism. 2. Chronic articular rheumatism, fixed or partial. Nodosities of Heberden. Generalized chronic rheumatism causes amyotrophies predominating in the extensor muscles of the diseased joints, exaggeration of the tendon reflexes. With the amyotrophy, there exists a contracture in the latent state, reflex spasmodic contracture of joint origin. Lecture 7, on 6 cases of hysteria in the male subject. Summary. Hysteria in the male is not so rare as one might suppose. Role of traumatism in the development of this affection, railway spine. Tenacity of hysterical stigmata in typical cases in both sexes. Account of 3 typical and complete cases of hysterioepilepsy in the male. Striking resemblance which these cases bear to each other and to the corresponding cases observed in the female sex. Lecture 8. Summary. Abdominal forms of the hysterical attack in man. Detail of a case in which the seizures took aspects of partial epilepsy. Diagnosis of this case. Importance of the hysterical stigmata. The convulsive seizure may be wanting in hysteria of the male. Description of a case of bronchial monoplegia in a man 19 years, hysterical. Difficulty in diagnosing these cases. Author's Preface. The lectures which Dr. E.P. Hurd has decided to reproduce in this volume pertain for the most part to hysteria, and especially to hysteria in the male sex. This is a subject which for a number of years has attracted my attention and been made by me a theme of study, and I am surprised that it has been so long ignored, or at least so far neglected, for it is one of the most interesting subjects of nervous pathology. Male hysteria belongs truly to everyday medical practice, and not to know it, not to be aware that it exists in both the man of culture and in the working man devoted to manual labor, is to render oneself liable to frequent mistakes, and mistakes which may be quite serious from a professional point of view. I recognize, moreover, the fact that if, more fortunate than my contemporaries, I have been able to study this affection under its diverse aspects, this task has certainly been facilitated by the great number of patients who present themselves every day at the clinic of the Salpêtrière. I have also been struck by the fact that male hysteria is found with the same characters in men belonging to all races, all nationalities. So, when my views were first made known, I did not hesitate to affirm that those of my confrères in foreign countries who made a point of disputing, at least as far as their own country was concerned, the existence of the facts which I have pointed out, would in time acknowledge the justness of my positions. The event has proved that I was right. From all quarters of the world at the present time, observations similar to my own are multiplying. I take pleasure in thinking that through the publication of works like this, which Dr. Hurd now presents to the medical profession of the United States, the question of hysteria in the male sex will receive from physicians in that great republic the attention that it deserves, and thereby science will be enriched by new facts and make still further advances. Charcot, Paris, August 1st, 1888. Translator's Preface. Jean-Martin Charcot was born in Paris, September 29, 1829, so that now he is in his 60th year. Appointed intern of the hospitals in 1848, physician of the Central Board of Hospitals in 1856, physician to the Salpêtrière in 1862, Dr. Charcot began in that hospital in 1866 a course of theoretical and clinical teaching on chronic diseases, diseases of old age, and diseases of the nervous system, a course that was kept up by a series of lectures given every year till 1878. Chief of the Department of Clinical Medicine from 1853 to 1855, agrégé in 1860, he was elected to the chair of pathological anatomy of the Faculty of Medicine of Paris in 1872. From this time till 1881, he gave every year, regularly, the official course, theoretical and practical, of pathological anatomy. Since January 2, 1882, Dr. Charcot has held the chair of clinical instruction in diseases of the nervous system at the Salpêtrière, An enumeration of all the titles and honorary offices which have been bestowed upon Professor Charcot would take up too much space in this preface, for he is an honorary member or corresponding member of the principal scientific and medical societies of Europe, besides being connected with several in this country. A few only of these titles will be given here. Member of the Academy of Medicine, Paris, 1872. Corresponding member of the Royal Society of Natural Sciences of Brussels, 1874. Corresponding member of the New York Society of Neurology and Electricity, 1874. Honorary member of the Clinical Society of London, 1874. Honorable member of the Harveian Society of London, 1878. Honorary member of the King's and Queen's College of Physicians in Ireland, 1887. Doctor of Laws of the University of Edinburgh. Honorary Doctor of the University of Boulogne, Honorary Member of the Society of Physicians and Surgeons of St. Petersburg, Honorary Doctor of the Faculty of Würzburg, etc., etc. Dr. Charcot has been connected with the founding and management of 3 medical reviews: the Archives of Normal and Pathological Physiology, published by Brown-Séquard, Charcot, and Vulpian. Volume 1 appeared in 1868. The Revue Mensuelle de Médecine et Chirurgie, published by Charcot, Chauveau, Wallière, Parrot, and Verneuil. This journal first appeared in 1877. The Archives de Neurologie, a quarterly review of the nervous and mental diseases, published under the direction of J.M. Charcot, Editor-in-Chief. Dr. Bourneville. This journal was founded in 1880. I shall enumerate as rapidly as possible Professor Charcot's leading contributions to medicine. 1. A study of the affection described under the names of primary asthenic gout, nodosity of the joints, chronic articular rheumatism, primitive form. Thesis for the doctorate, Paris, 1853. Charcot's researches on this disease comprehend a vast number of clinical and necroscopic observations made at the Salpêtrière. One of the most important facts brought to light by these researches is that the affections of the heart, such as endocarditis and pericarditis, belong to the generalized form of chronic articular rheumatism, as well as to acute articular rheumatism. Another result of these researches is to establish an identity between the affection known in surgery under the names dry arthritis, arthritis deformans, morbus coccidiosis, etc., and nodular rheumatism. In other words, we have not here 2 distinct diseases, but 2 forms of one and the same disease. One of these forms is chronic primitive articular rheumatism, fixed or partial. The other is chronic primitive articular rheumatism, generalized or progressive. The separation of gout and chronic articular rheumatism is maintained in all its rigorousness. In this study, Dr. Charcot describes the symptomatology in a strikingly original manner. Among the etiological circumstances, he insists especially on the prolonged action of cold and moisture combined, a condition often realized by habitual sojourn in badly lighted, damp habitations. 2. Of the non-existence of an excess of uric acid in the blood in subjects affected with nodular rheumatism. In this treatise, Charcot shows, as the result of his researches, that the presence of uric acid cannot be detected in the serum of the blood in chronic articular rheumatism, while in acute and chronic gout the existence of crystals of uric acid has always been clearly recognized. This fact separates gout from all forms of rheumatism, whether acute or chronic. 3. Alterations of the cartilages in gout, 1857. The author of this treatise, having had the occasion to examine fragments of cartilage from a gouty patient, found them infiltrated with urate of soda under both the amorphous and crystalline form. 4. Contributions to the study of anatomical alterations of gout, and especially of the kidneys and joints in gouty patients, in collaboration with M. Corneille. In this memoir, Charcot considers the alterations of the kidney observed in the gouty and gives some new researches on the alteration of the joints. Gouty nephritis is by no means rare. It is attended with deposits of urates in various parts of the kidney and frequently with symptoms of renal colic. The lesions may be those of parenchymatous or interstitial nephritis, and the general symptomatology is that of chronic Bright's disease. 5. On the structure and mode of development of the giant cells in tubercle, 1878. In this paper, the author endeavors to show 1. That the giant cell is constituted in principle by a mass of cellular elements heaped together, endothelial mass. 2. That the elements constituting this little mass undergo a particular modification, which may be called vitreous transformation, having for effect to bring about the agglutination and fusion of the different cells which are affected, while the nuclei enter into active proliferation. 3. That this vitreous transformation, ending in caseofication, proceeds from the center to the periphery of the cellular mass, which explains the different aspects which the giant cell presents in sections. 6. On painful paraplegia supervening in certain cases of cancer. In this communication, Charcot shows that the frequent coincidence of cancer of the breast with an aggregate symptoms which he proposes to designate as painful paraplegia is due to secondary deposits of cancerous matter in the bodies of the vertebrae, especially in the lumbar region. 7. On acute miliary carcinoma. An interesting treatise embodying some observations exemplifying the close similarity which exists between acute miliary carcinoma and acute miliary tuberculosis. 8. Typhoid pyrexias, eruptive fevers, cholera. Under the above head we have several valuable articles on fevers and on cholera. 9. Laryngeal affections and typhoid fever, in collaboration with M. Deschambre. 10. Anatomical and nosological characters of yellow fever and grave icterus. 11. On the epidemic which prevailed in St. Petersburg in 1865. 12. Note on the temperature of the rectum in Asiatic cholera. 13. Alterations of the blood, leukocythemia, melanemia. The above papers, whose names only are mentioned, were founded on original observations and have materially advanced science in reference to the subjects to which they pertain. Charcot's contributions to diseases of the vascular system have been considerable. The following are especially worthy of mention. 14. On sudden death from obstruction of the pulmonary artery by blood clots in cases of phlegmasia albidolens and phlebitis obliterans, 1858. This work, which contains the first observation of death by pulmonary embolism published in France, contains very extensive analysis of the German works on the subject. The author describes fully the symptoms which characterize accidents of this kind, gives precise indications as to diagnosis and prognosis, and a careful study of the mechanism which presides over the displacement of clots in the venous system. 15. Case of acute rheumatism with comatose symptoms, then hemiplegia, softening of the cerebrum, multiple fibrinous deposits in several of the viscera, and in particular in the spleen, dysenteric lesions of the colon, endocarditis with fibrous vegetations. The above memoir contains much that was new at the time of its appearance in 1852. The labors of Virchow and Kirkes in the same direction were not then known in France. 16. Gangrene of the foot and of the leg, multiple fibrinous deposits in the kidney, spleen, liver, etc., 1856. This observation pertaining to a subject affected with calcareous incrustation of the sigmoid valves is a striking example of those arterial and capillary embolisms which have since that epoch been made the subject of so much study. In this memoir, Charcot sets forth and criticizes Virchow's theory of embolisms, then scarcely known in France. 17. Notes on a case of multiple fibrinous tumors containing a puriform matter situated in the right ventricle of the heart, etc., 1852. 18. Remarks on some fibrinous cysts containing a puriform matter observed in 2 cases of partial aneurysm of the heart, 1854. 19. On acute ulcerative endocarditis of typhoid form, based on a case of ulcerous affection of the tricuspid valve with typhoid state and the formation of multiple abscesses in both lungs, in common with Monsieur Vaupien, 1861 to 1862. The 3 memoirs given above contain the first observations of the kind published in France, and have been the point of departure of quite an extensive medical literature. The paper on ulcerous endocarditis of itself marks an era of modern medicine. 20. On arterial thrombosis supervening in certain cases of cancer, 1865. In this paper, Charcot shows that in subjects affected with cancerous disease of long standing, arterial thrombosis, without previous alteration of the wall of the vessel, may take place as well as venous thrombosis, although the latter is far the most frequent. The 5 following papers pertain to diseases of the respiratory organs. 21. Pathological anatomy of acute bronchopneumonia, 1857. 22. On chronic pneumonia, 1860. 23. New anatomopathological and clinical researches on the chronic pneumonias, cirrhosis of the lung, 1878. 24. Studies in experimental pathology relative to pneumoconiosis, 1877. 25. Anatomopathological researches on phthisis, tuberculosis of the lungs, 1877. The treatise on bronchopneumonia contains a more precise description than medical science had heretofore possessed of the microscopic lesions of the pulmonary parenchyma in acute bronchopneumonia, considered at its highest degrees of development. 1. The splendized portions occupying the greater part of the extent of the pulmonary lobule. 2. Nodules of parabronchial hepatization disseminated, like the islands of an archipelago, among the parts affected with splenization. The histological examination shows that in these latter parts of the alveolar cavities are filled with swollen globular epithelial cells and a few leukocytes. The constitution of the peribronchial nodules is as follows. Around the lobular or acinus bronchiole, blocked, as is generally the case, by a mucopurulent concretion, the pulmonary alveoli, in 2 or 3 concentric rows, have their cavity distended either by an accumulation of leukocytes or, as oftener happens, by leukocytes embedded in a fibrinous exudation, which besides contains a few epithelial cells. The existence of this fibrino-purulent exudation in the peribronchial nodules shows that the presence of fibrine and leukocytes in the pulmonary alveoli can no longer be considered as a peculiar characteristic of the hepatization of lobar pneumonia. There is much that is new in the treatises on chronic pneumonia, and especially under the head of pathological anatomy, in which study Charcot has introduced system and definitiveness where there was before vagueness and confusion. In the study of pneumoconiosis, Charcot records a series of interesting experiments on guinea pigs, which were made to inhale in bags 2 hours every day certain kinds of mineral or coal dust. It was found, on killing the animals, that these powders had penetrated the air cells and were followed by certain lesions, such as swelling of the pulmonary endothelium and proliferation of these cells, and consecutive subacute inflammation of the alveolar wall itself and thickening of this wall, leading to concentric contraction of the alveolar cavity. Charcot shows that the facts of experimentation, symptoms and lesions, exactly correspond with the facts of pneumoconiosis, anthracosic, silicic, siderotic, observed in man as a result of an occupation exposing him to the action of solid particles diffused into the air. A resume of Charcot's lessons on tubercle, conferences delivered before the faculty 1877 and 1878, would be of great interest, but the abstract would take up all the space allotted to this preface. 26. Dr. Charcot's contributions to medicine under the head of diseases of the liver, biliary passages, and kidneys have been summarized in a work entitled Lessons on Diseases of the Liver, etc., and published in 1877. Second edition enlarged, 1882. The Lectures on Diseases of the Kidneys was translated into English by Dr. H. B. Millard, New York, in 1878. When the history of medicine shall be properly written, a task which will require more than one Aristotle, the additions which each individual shall have made to the existing fund of knowledge will be properly recorded. Such a work does not yet exist, and it is necessary to search through countless memoirs, which are often buried in the archives and comptes rendus of learned societies, to find what one is looking for in order to render to the indefatigable worker the credit that to him is due. Several of Charcot's memoirs on the pathology of the liver have been invaluable additions to our knowledge of the subjects of which they treat. His first experimentally determined, in guinea pigs, hypertrophic cirrhosis of the liver of biliary origin, and showed its identity with the disease which develops in man as a result of obstruction of the common bile duct. The different phases of the morbid process may, according to Charcot, thus be summed up: angiocolitis, periangiocolitis, cirrhosis. The disease in man, as is now well known, is often produced by the arrest of a gallstone in the ductus choledochus, or by compression of the latter by a tumor, cancer of the head of the pancreas, for instance. In these cases, the connective tissue framework of the hepatic gland undergoes hyperplasia, and the whole organ enlarges. Charcot's researches on the common or atrophic form of cirrhosis of the liver, gin drinker's liver, have hardly been less fruitful. He has, more than any of his predecessors, insisted on periphlebitis as the cause of this affection, and shown the extension of the inflammation from the veins to the connective tissue, which forms bands or rings around the lobules, annular cirrhosis, compressing them and causing that granular atrophic condition first described by Laennec. His observations clearly differentiate this form from the other types of interstitial hepatitis. Charcot's researches on grave icterus, on interstitial nephritis, which he was the first experimentally to produce in animals by ligature of one of the ureters, an experiment which brought out the striking fact that the alteration of the epitheliums precedes the connective tissue proliferation, and on the various forms of Bright disease, have been equally original, and are monuments of painstaking industry. Charcot has made many contributions to the literature of skin diseases. The following are mentioned here only by title. 27. On erythema produced by the action of electric light, 1859. 28. Bronzed coloration of the skin with fatty alteration of the suprarenal capsules, Addison's disease, in collaboration with Vulpian, 1858. 29. Note on several cases of skin disease dependent on the influence of the nervous system over nutrition, 1859. 30. On a case of zona of the neck with alteration of the nerves of the cervical plexus and corresponding ganglia of the posterior spinal roots, 1866. 31. On scleroderma, 1872. 32. On rapid or sudden blanching of the hair, 1861. 33. Clinical Lectures on the Diseases of Old Age, Paris, 1878. American translation by L. H. Hunt, 1881. In the preparation of this, in many respects the most important work heretofore published on the subject, Charcot was aided by the researches and studies which he had previously made on gout and rheumatism. 7 chapters are taken up with a consideration of gout in its various forms in the aged, and 9 with rheumatism, the chronic articular forms being especially dwelt upon. There are several original chapters on the febrile state of the aged and on the clinical importance of thermometry in old age. Dr. Charcot has also made some observations on the pneumonia of old age, which are recorded in the inaugural thesis of Dr. Bergeron. 34. Atheromatous alterations of the arteries, and endarteritis deformans. The above treatise comprises the second fascicule of Lessons of the Diseases of Old Age, second series. We here find an exposition of the epoch-making discovery of Charcot and Bouchard of the miliary aneurysms, consequence of endarteritis, and cause of the cerebral hemorrhages which characterize especially the apoplexies of old age. The following papers pertain to the pathology of old age. 35. Observations relative to the spontaneous gangrene in aged patients. 36. On senile osteomalacia. 37. On the trembling senile chorea of some writers. 38. On common chorea in old people. In the enumeration of Charcot's works, there should follow here 3 memoirs on Basdow's disease, whose obscure pathology Charcot has done much to clear up by his careful observations. His first treatise on the subject was read before the Biological Society in 1856. Exothalamic cachexia, heretofore almost unknown in France, is described in this paper on the basis of a remarkable case observed in Charity Hospital. The writer attributes the symptoms of this disease to a vascular neurosis, finding expression in palpitations of the heart and arteries, tumefaction of the thyroid gland, and debile exothalmia. Charcot's contributions to the study of the diseases of the nervous system, memoirs and treatises more than 100 in number, are altogether too numerous to obtain mention in the limited space allotted me by the publisher for this preface. Nervous pathology is the most difficult part of human pathology, requiring the nicest pains in dissection and preparation, the highest powers of discrimination. Every department of morbid innervation has been enriched by Charcot's discoveries. I shall only allude to his principal contributions. 42. Clinical and anatomopathological researches on cerebral ramollissement and encephalitis. This work, made with the assistance of Vulpian, first brings out the fundamental distinction between cerebral ramollissement and encephalitis, the former being due to ischemia rather than to congestion. The precursory symptoms are different. Dizziness and mental enfeeblement characterize ramollissement. Delirium, convulsions, contractures belong more particularly to encephalitis. The tardy contracture, so frequent in the paralyzed limbs of patients suffering from old ramollissement, is to be referred to consecutive lesions of the spinal cord, secondary descending sclerosis. According to Charcot, conservation of consciousness with sudden invasion of paralysis belongs rather to ramollissement. Variable hemiplegia belongs to it exclusively, and aphasia almost exclusively. 43. New researches on the pathogeny of cerebral hemorrhage, in collaboration with M. Bouchard. English translation by T.S. McLagan, 1872. In this work, founded on a multitude of observations, cerebral hemorrhage, particularly in the aged, is referred to as rupture of aneurysms of the small arteries of the cerebral substance. These aneurysms are 1 millimeter or more in size and have never been wanting in any case of cerebral hemorrhage observed by Professor Charcot. 44. On secondary degenerations of the spinal cord, 1859. In common with Monsieur Vulpian. Creveillet and Turc already called attention to these degenerations as consecutive to lesions of the hemispheres, and Charcot and Vulpian in this memoir add a number of facts confirmatory of the observations of the German pathologist. The subject is presented by them in a new and clearer light, with considerable additions to our knowledge. They also record similar degenerations following lesions en foyer of the spinal cord. 45. A. Localization in diseases of the cerebrum. B. Study of motor localizations in the cortex. The above titles comprehend 2 works published by Charcot in 1876. The first has been translated into English by Dr. Millard. Charcot, in the main, accepts the new views of cerebral localization set forth by Ferrier, Hitzig, Franck and Petrus, Nottinangle, etc. His views, based on a vast number of observations made in the Salpêtrière, are treated at length in the above works. They have recently been popularized by him in an article in the Forum for August 1888 entitled The Topography of the Brain. This publication embodies a course of lectures delivered before the faculty in 1875. 46. Localizations in the cerebral ganglionic masses of the hemispheres of the cerebrum, lesions of the internal capsule in particular. The symptoms which accompany lesions limited to the central gray nuclei, lenticular nucleus, caudate nucleus, optic thalamus, are those of common cerebral hemiplegia, which is generally little pronounced, temporary, and consequently benign. On the other hand, lesions of the internal capsule produce a very pronounced and relatively persistent hemiplegia. Tardy and permanent contracture of the paralyzed limbs is habitual consequence. If the lesion occupies the anterior two-thirds of the capsule, the paralysis will pertain exclusively to movement. If, on the contrary, it affects the posterior third of the capsule, cerebral hemianesthesia necessarily follows. 47. Clinical characters of cerebral hemianesthesia by organic lesion. 48. The focal lesions of the cerebral hemispheres which produce hemianesthesia determine crossed amblyopia and not lateral hemiopia. The two above memoirs, which are among the most original productions of our author, are further contributions to the study of cerebral localizations. 49. Secondary degenerations of the spinal cord in cortical lesions of the hemispheres. In this memoir, Charcot shows that lesions of the so-called motor zone, even without participation of the internal capsule, determine secondary spinal degenerations. It is another powerful argument in support of the modern doctrine of motor localizations in the cortex. I shall be obliged to pass over Charcot's valuable contributions to the study of localizations in diseases of the spinal cord. A work with the above title comprises the lectures delivered before the faculty in 1880 and has been translated into English and German, and there is an American translation by Professor Comegys of Cincinnati. It is well known that the histological labors of the past 50 years, besides differentiating the spinal cord into its nervous and connective tissue elements, have brought to light the fact that it is composed of numerous centers and systems having special functions. To elucidate the properties of these several parts, physicians and physiologists have wrought earnestly, and what was once a terra incognita has now become tolerably well understood. Few, if any, have contributed more to our knowledge of the spinal cord in its physiology and in its pathology than Professor Charcot. His discoveries in the department of the scleroses alone, locomotor ataxia, multiocular sclerosis, fasciculated sclerosis of the lateral columns, also in the department of infantile paralysis, amyotrophic paralysis of the adult, labioglossolaryngeal paralysis, would have given him a lasting name, besides rendering him a benefactor of mankind. Dr. Charcot's contributions to the nervous diseases are for the most part embodied in the following works. Leçons sur les maladies du système nerveux, Volume 1, 1877. Leçons sur les maladies du système nerveux, Volume 2, 1877. These two volumes have been translated and published by the Sydenham Society. Leçons sur les maladies du système nerveux, Volume 3, 1887. These volumes comprise each about 500 pages and are profusely illustrated. I have but one observation to make relative to style. Charcot seems to me to add to the merit of original investigation and independent, fruitful thought the possession of a clear and picturesque style. His ideas come clothed in just the right words, and this is eloquence in a scientific sense. He is one of the most translatable of writers, for seldom can any other form of words so well express his meaning as those which he has chosen. His mind is, in fact, essentially cosmopolitan. In the above enumeration of writings, I have simply culled from more than 200 treatises, all emanating from the same fertile hand and brain. Possibly, many of those which I have omitted are more important than those which I have mentioned. The discoverer of scientific truth is to be envied. I can imagine no task more worthy of the human mind than the search for and the unfolding of new facts in nature. I believe that when the discovery pertains to the laws and processes of the human economy, physiological and pathological, the subject becomes one of transcendent importance, for here is something that immediately concerns our welfare and that of all our fellow men. Therefore, I would rather have been the author of those 3 works of Charcot last enumerated, than have written Paradise Lost, the Inferno, or Don Quixote, and this because above the literary I value the scientific, and above the aesthetic the practical and useful. The literary man may evolve out of his inner consciousness a work of genius which shall captivate the masses and yet shall afford nothing but pleasure and entertainment. The scientific man, on the contrary, who would find out the nature of hypertrophic cirrhosis of the liver, must make many careful autopsies and dissections under circumstances that would be repulsive to most persons, and must spend wearisome hours over the microscope. He must, moreover, perform numerous vivisection experiments on animals in order to determine the conditions of the disease, and must patiently watch the results, and this involves a long and toilsome work. Nor can he hope as his reward that the masses will be interested in his work, but his recompense must ever be the satisfaction which he feels in his chosen pursuit, the consciousness of being useful, and the appreciation of a few whose approbation he prizes. A Zola or a Dumas may publish many works which shall run through 95 editions, but Zola and Dumas will soon be forgotten, while Charcot will ever rank among the immortals of this earth. Charcot's life, if it has not been a very eventful, has been a very busy one, and he is still in the flower of his manhood, just as able to do effectual work as ever. It is hoped that the cares of an ever-increasing practice will still leave him time for original investigation. The present volume was culled from Volume 3 of the Lessons on Diseases of the Nervous System, which has not heretofore been translated into English. Charcot's study of late have been rather in the department of the so-called functional diseases of the nervous system than the organic. I have to thank Professor Charcot and his obliging pupil, Dr. Marie of the Salpêtrière, for assistance in the preparation of this volume. E.P. Hurd, M.D. Newsbury Port, September 20th, 1888.